The results of this study may not have been super surprising, but they are super important, at least for anybody who's trying to take care of their brain. I'm Dr. Brooke, and this is Cook with Dr. Brooke, where we talk about the connection between nutrition and mental health outcomes with a board-certified psychiatrist. And today we're talking about the recent Pointer study. This was a study conducted with thousands of individuals over 2 years, looking at how different lifestyle interventions can affect cognitive changes with aging. I think it's important to point out that there are normal cognitive changes with aging, or there's non-pathological changes that happen to our thinking and our memory as we get older. Same thing with our muscle mass changes as we age. Same thing with lots of things in our body can change as we age, and it doesn't always mean that it's pathologic. Not everybody's name that you forget means that you have dementia. So the group of people that they were looking at were at a greater increased risk for cognitive slowing and for dementia. And then they put them in one of two groups. Both groups got positive lifestyle interventions around diet, around exercise, around health maintenance, seeing their doctors, around cognitive tasks and socializing, and all of these good whole health integrative interventions. They looked at how does this affect their brains. One of the groups was kind of recommended these things, taught about these things, and the other group was more structured and followed more closely. Importantly, both groups not only slowed the progression of their cognition, but improved their cognitive scores over these 2 years. And the group that did so under a more structured, regimented, purposeful way did much better than the other group. The important thing is that these are interventions that you can take even without getting a prescription. So whether or not you've seen your doctor, they are interventions that are accessible to a lot of people to different degrees. Whether or not you have insurance, whether or not there's a primary care provider near you, whether or not you have access to those other things, you can implement a lot of these changes already. And I think a lot of people have the belief or the impression that dementia and cognitive decline as we age is kind of just out of our hands, that, oh, it runs in the family, or you just get unlucky. And certainly there is an element of that. It's not like running on the treadmill every day and only eating a perfect diet is going to prevent everybody from developing these conditions. But they can lower your risk, and they can lower the other cognitive changes that we see with aging. So I hope that learning about this makes people feel empowered to be taking more care of their brains and their bodies and taking care of their health, because it's not necessarily all just like what's in the cards. We have agency in this as well. If you're interested in more information about the connection between food and mental health outcomes, that's kind of what this whole channel is about. So I hope you'll follow along. Take care of yourselves, guys.